Thank you very much. I'm really deeply honored to be the recipient of the Eileen O'Brien Graef Award. And while I did not have the privilege of knowing Eileen personally, it's really very clear to me from reading and viewing all of the tributes to her that she was really an incredible woman who left an indelible mark and legacy on a number of you here today. I'm also a mother, and seeing all of you high school students here today. My kids are a little bit older than you, but seeing all of you here today, and those of you who are 5 years up and more, what you do and what you are going to bring to our world tomorrow is really important. So it's really impressive to see you here today for an activity like this. Now, I'm a breast cancer medical oncologist who has worked in this field, dare I say, mercifully didn't ask us our exact age, but over 2.5 decades. And I think most of you in this room know the devastation that a breast cancer diagnosis can cause. It is the leading cause of cancer amongst North American women, and is the second leading cause of cancer-related deaths in this country. And as a medical community, we really have made tremendous strides in the treatment of breast cancer and its early detection. As a result, breast cancer-related mortality has declined steadily over the last several decades. And with our current advances that are really happening at a dizzying pace, the outlook remains better and better for women diagnosed with this disease in this country today. So one thing that I want to leave you with, and I know that's not the topic of prevention, but I do want to leave you with a message of hope, or start this off with a message of hope, is that for the vast majority of North American women who are diagnosed with breast cancer today, the vast majority of them will survive and thrive with having had this diagnosis. Nonetheless, unfortunately, some women will succumb, and many of the women who are diagnosed with breast cancer will obviously have to suffer the side effects and toxicities of the treatments that we prescribe. And I think it's probably abundantly clear to all of you in this room and to most of us in this field that the best way to prevent a cancer-related death would be never to have anyone diagnosed with this disease. So this has been a very active area of research in the medical community, and I want to share with you some of what we know about breast cancer-related risk factors and some of what we can do to prevent this disease. Now, we know that there are a number of different breast cancer-related risk factors, but breast cancer isn't one of those diseases where there is a single dominant risk factor. And as an example, if we think about lung cancer and smoking, there's a very, very clear link. And in that situation, smoking is at least theoretically a modifiable risk factor, and you're going to hear more about it's not so easy to modify. The best thing I can say to all of you who are of the age where you haven't started yet, don't start, okay? Because it's not so easy to quit once you've started smoking or been exposed to tobacco-related products. But in the case of breast cancer, we do know that there are some risk factors that can be modified, but some that can't. For instance, family history is a well-recognized risk factor for breast cancer. And for women who have a family member, a first-degree relative with breast cancer, they have up to a 2-fold increased risk of developing this disease. And that risk is increased further if their first-degree relative is diagnosed at a younger age. And for a small subset, about 10% of all women with breast cancer, they develop it because they have inherited a predisposition to this disease. And when we say somebody has a hereditary predisposition or inherited a predisposition, what we mean is that they have inherited a single mutation or a change in a single gene that significantly increases their risk of developing breast cancer. And the one that I think we hear a lot about in the media, and that's the most common one, are mutations in genes like BRCA1 or BRCA2. BRCA1 is a gene that Angelina Jolie had, and that she, I think, in such an important way, shared with us something about her that was so impactful on all of us. Now, unfortunately, at least in 2020, there's not a lot we can do about what we inherit, the genes that we inherit from our parents. But knowing that information can be incredibly impactful because we now have good data that women who inherit mutations in BRCA1 and BRCA2 can do something to minimize their cancer risk. What studies have shown is that more intensive cancer screening or preventative surgeries can significantly reduce the risk of a mutation carrier developing that cancer. Obviously, what we would like to be doing is something far less aggressive and intrusive than recommending surgery to people who inherit mutations in those genes. And there's a lot of active research, a lot of federally funded and foundation-funded research that is going into trying to elucidate better means of preventing cancer in people who have an inherited predisposition to this disease. I also want to parenthetically note that when we talk a lot about women, men also can inherit mutations in BRCA1 and BRCA2. They also have increased risks for developing some cancers if they have a mutation in one of those genes, and they can pass it on to their children. So for those of you, again, and I tell that to our medical residents, our fellows, my colleagues, to remember what you were taught in high school biology about inheritance. That's true for a lot of diseases in medicine, and it's an important thing. What you are learning today is a foundation in AP Bio and below is a foundation for a lot of what we do in medicine. The other thing about genetics is that it impacts not only the individual, right? It impacts their whole family. And so there has been a lot of research, and we and others have been involved in research, that once somebody finds out that they have a mutation in one of these genes, it's critically important that we figure out how they share that information with other family members so that they can be empowered to do something about that as well. And the other notion of this is while we live in Washington, D.C., and people have access to academic medical centers and big hospitals where you have access to services like genetic counseling and testing, that's not true for large parts of this country. So again, there has been a lot of research that has been ongoing to figure out how we avail people of some of these services who aren't in parts of the country where they have easy access to this. Now, there are a host of other risk factors associated with breast cancer, and some of these can be modified, and these fall under categories like lifestyle factors or some reproductive factors. So alcohol is a recognized risk factor, weight is a risk factor for breast cancer, exercise is important, breastfeeding is important. I just want to touch on some of those very quickly. We know that even one drink a day can modestly increase the risk of breast cancer, but more excessive drinking can increase the risk more significantly. So it's important for many health-related things that we should be thinking about to recommend moderate alcohol intake. Weight, I think we hear about all the time, and really it is going to surpass smoking and other environmental exposures as the leading cause of cancer in this country. Obesity is a risk factor for many, many, many diseases, cancer included and breast cancer included. We know that women who are obese have a significantly increased risk of developing breast cancer in their postmenopausal years. We know that even more normal weight or overweight women who have a higher percent body fat also have an increased risk for developing breast cancer. And again, breast cancer is just one of the many diseases that is associated that has that relationship between obesity and increased risk. So maintaining healthy body weight is something that we really need to focus on, and that's a very multifactorial issue that I think many of you in this room are much more involved in and know much more about. Exercise is good for everything, too. It's also good to reduce the risk of breast cancer, so we know that it's important for women to exercise, and that helps to reduce their risk. And one of the other factors that we know about and that we talk about is that breastfeeding is protective against breast cancer. So we know that women who breastfeed for at least 3 to 6 months after each pregnancy reduce their risk of developing breast cancer. So it's a very important, I think, public health message that breastfeeding is not only important for the baby, it's also important for the mother's health. So despite everything that we know about these breast cancer risk factors, and I promise you I haven't gone through all of them by any means, it only accounts for about 60% of the known breast cancer risk factors. So what we understand is that there's a lot that we don't yet understand. And that those 40% or so of women who develop breast cancer who don't have any of these recognized risk factors, it's probably because of some complex interplay between environmental exposures and our own makeup, how we metabolize some of those things that we're exposed to. And this combination of events probably have some interplay on how people develop breast cancer. And I don't want to leave you with the notion that the medical community and the scientific community have not tried to decipher those. It's really, really hard to prove causation. Many risk factors are interrelated, and it's very hard to tease them out. But I know some of the work that this foundation does and this supports is trying to further elucidate some of those underpinnings of cancer. We have also made strides in how we can prevent cancer in women who are at increased risk for a variety of reasons. There have been several very large federally funded studies and some studies funded by others that have shown that if we identify women who are at increased risk, there are medications that we can give to diminish their risk for developing breast cancer. And those are very well characterized or very well carried out randomized clinical trials that have shown that. So what do I want to leave you with? I think I want to leave you with a concept and something that's very important just for anyone who is diagnosed with breast cancer. The prognosis is really excellent in 2020. It's complicated. There are also some people, due to socioeconomic factors and racial factors, that have a worse prognosis, and that's something that we're really trying to better understand. But we have made tremendous strides in the treatment of breast cancer, such that we now can tell most women who are diagnosed that they will survive their disease. We're also learning how to pull back on some of our toxic treatments and to be better able to personalize or individualize the care that we give so that we're not exposing everyone to all of the toxicities of the various treatments that we have at hand. But obviously what we want to do is prevent women from ever developing this disease. And a thing that I think that all of you can know, it's important to be empowered, to know about your family history. There is a family history of a disease, to talk to your healthcare provider about it. Not everything is genetic. In fact, most things aren't. So I don't want people to leave here thinking that they likely have a genetic predisposition. They don't. That is uncommon. But it is important to know about it and talk to your healthcare provider about it. There are things that we can do to minimize breast cancer risk. So maintaining healthy body weight is critically important for so many things, as we talked about. Exercise, keeping alcohol intake to moderate levels, and encouraging breastfeeding, not only for the baby's health, but also for the mother's health. And then clearly, the importance of further research to better understand the underpinnings of breast cancer so we can further minimize risk. So I want to thank you again for this award. I'm very deeply grateful, and I want to thank you for your attention.